Welcome back. It's 8:43 right now, and today's Mental Health Monday. We're talking about Hispanic culture as we're celebrating Hispanic Heritage Month.
Yeah, many in these cultures actually fear being labeled loco if they express anxiety and don't want to be viewed weak or mentally unfit. So joining us this morning to kind of give us a breakdown, we welcome licensed psychologist Dr. Cheryl Ziegler. Thank you for joining us this morning.
Thanks for having me.
This is a major stigma. How can some of these folks that have this view kind of maybe overcome it and get help that they need?
Yeah, so first I think it's important to set up, right? When we say Hispanic, there's a lot of different kinds of subcultures that fall under that, so I get that. But in general, I think it's important for people to understand that particularly in a Hispanic culture, they don't want to be seen as mentally ill or unfit for things. And so what they do, and I have this in my own family, is we're more comfortable talking about physical illnesses. Oh, my back hurts. Oh, I have all these headaches. Oh, my joints hurt. And so what they wind up doing is going to the doctor, and then they go to the doctor and they say, which are true. I have a back pain. I have constant headaches, whatever it might be. I've got fatigue. And so that's a comfort zone. And if you don't have a culturally competent, just general doctor, right, a PCP, then they might just prescribe medication for that, right? They might order blood tests, not realizing that actually it's a really common Hispanic manifestation to take your mental illness and turn it into physical illness.
Wow.
So I just want to set that up first.
Yeah, absolutely.
And then the what to do about it, right? I'm really passionate about this because the stats are really concerning. So again, among the umbrella of what is considered Hispanic, different subcultures have different rates of what they consider mental illness. Puerto Ricans, which I'm half of, are almost the highest at like around 28% would be considered to have a diagnosable mental health condition. So what happens is then out of that, only about 10% seek treatment. And that's sort of across the board. So we have higher percentages in some Hispanic subcultures that have mental health issues that are not getting treated. I mean, 10% is so low. Yeah. So what would help are doctors who, number one, are culturally competent, that understand these things, and take the language barrier out. So if you have someone who's Hispanic speaking, who's Spanish speaking, and you don't speak Spanish, get an interpreter in your office. Yeah. Maybe have one day of the week where that interpreter's there, and that's where you see your Spanish speaking patients. We have over the last couple of months been focusing a lot on general practitioners because people don't start with psychologists.
Right.
They start with their doctor who they trust or who they go to for their kid or for themselves. So that's number one. And then you want to move on to other things like inviting in family members. That's really important in a Hispanic culture, usually either even your immediate family or your extended family. Invite them on in. That's the way we sort of function. So that's really important. And then also just talking about the psychoeducation. Talk about what is depression, what is anxiety, what are, maybe common children's mental health conditions like ADHD that we're seeing that maybe they might not know about. They don't have the language for it. So we have to do actually a lot to change this because this is really a very serious problem.
It is, and I think the acknowledgement of it, and also you were talking about some of the numbers. I mean, mental illness, there is a percentage of, folks in this community that have this, and so identifying it and being comfortable talking about it is the biggest first step.
Yes. Always. I always feel like I'm saying, we have to talk about it. But even driving here today, I was listening to a podcast and somebody from an Indian culture was talking about some unique things. And I just learned so much. It was like really enlightening. Like if we just talk about it, hey, in my culture, this is the way things are. You walk away like, okay, I can take that. I can do something with that. Yeah. So talk. Yeah. I can't say it enough.
Yeah. Well, and I think this transcends across all minorities, right? Like opening that conversation a little bit more. So Dr. Ziegler, thank you so much for breaking that down for us.
Thank you.